was walking through the implant department the other day, minding my own business, when I happened to see this case. And this is a posterior case, tooth number 31, that's had an implant placed on it. And I looked down at the box and I saw there was a note that the doctor had sent his own abutment in. And I noticed how tiny this abutment was for a molar. And it's tiny because the implant's a 3.75 implant, which is kind of small for a molar. We'd certainly prefer something a little larger than that. And when you see it down in here, you look at it and you go, that's pretty tiny for a molar. It's not going to do, I don't know. I look at that and it makes me a little worried. If we put the Bruxer crown on top of this, you'll see when I take it out exactly what the situation is. But that's a pretty wide occlusal table for that abutment that the doctor sent along. And that abutment is a proper abutment for a 3.75 implant. I mean, to me, that's not the issue, that it was the wrong abutment that was sent in. I just think that is a small implant for that space. So if we look at this crown, you can see that we've got an implant that's off to the lingual. And when this is sitting on there, we're going to have a lot of stress. And so it's going to be sitting here and the patient's going to be biting down on the buccal. I mean, it'll be out of occlusion initially. But biting down, put a lot of stress on that implant assembly, and that's a screw kind of waiting to break. Anytime we have a skinny abutment like this with a wide crown, we don't have a great emergence profile. A lot of stress on the whole implant assembly, poor oral hygiene, lots of things getting caught underneath here, and it's difficult for the patient to keep it clean. So sometimes this happens with stock abutments. They're not perfect. They tend to have a uniform collar height, and so they can't really follow the contours of the gingiva like a custom abutment could. And also with a custom abutment, you can really dial in the collar vertical height as well, and so you can take a margin that's 4 millimeters subgingival and bring it up to just under a millimeter subgingival, so you can actually have a realistic hope of cleaning up the cement and getting it out of there so you don't cause some peri-implantitis. So we actually, on this case, called the doctor and said we would like to make a custom abutment, which we did, which looks a little more appropriate for a molar, especially when compared to the small nature of the other abutment. We got bigger surface area here, more support for the crown, better emergence profile, and it's going to be cleaner underneath there as well. So I'm going to go ahead and tighten this down. And that appears a lot more appropriate, an abutment size for a molar compared to that other much smaller one. And we're going to end up with a better restorative result when we do it this way too, for many reasons. Better emergence profile, better contours around the gingiva, easier chance to get good cement cleanup so we don't leave anything subgingival. And I think a lot of times dentists, we've got dentists who insist on having custom abutments like this because they know everything about it's going to be right on and right where they want it to be. And they're $299, whereas a stock abutment, typically, from us anyway, is $85. We actually sell stock abutments. It wouldn't work in this case. This is our stock abutment for a 3.5 implant, but again, that's too small for a molar. That's just not what we want to use here. And so dentists sometimes will go, well, your stock abutments are $85. And honestly, on every case, we will take one of these and try it in and see if we can find a stock abutment that will work for the doctor. But even if it does work, 90% of the time, there needs to be some modification and some prepping done on it. And that's another, I think, $75. So that's, $160. So that's really the choice is between $160 or $300. And a lot of these stock abutments from implant companies cost more than that. So when you factor in the cost of a stock abutment from an implant company and then the cost of us preparing it, sometimes it'll end up over $300, the cost of a custom abutment. And it's just such a nice bit of predictability. I always kind of joke about, I wish we could do something like this for teeth. I wish there was a way to be able to have a tooth preparation be as exact and precise as a custom abutment and could be done by the lab instead of us, the dentists, although we're not quite able to do that at this point. So there's definitely times where a doctor will send in the abutment. It could be an abutment they got from a surgeon. It could be an abutment that came with the purchase of the implant. But sometimes it's just not going to work and not be the best choice. And this was one of those choices where we had to call the doctor and suggest that we move up to a custom abutment. And honestly, it's not about trying to get the $299 out of the doctor. It's about doing what's going to work best in this case, what's not going to break the screw and lead to constant problems for this patient by taking a large molar and putting it on such a small abutment. That's really not what it's about. And you wonder why, a narrow diameter implant was used like this back in the area of the molar. And I've asked doctors sometimes, and they go, well, I had a bunch of extra of these and I wanted to get rid of them. And it's like, well, okay, I kind of get that. But and that's fine, I guess. I mean, you have a lot more surface area with a larger implant that's going to help you out. But if you do that, going with the custom abutment, as the doctor did in a case like this, once we called them back, is going to be a very good choice, and a choice that's in the best interests of the implant, the crown, and the patient.